Can you share ideas on connecting local senior service providers to seniors living independently who are um, Medicare, who are insured by Medicare or private insurance companies? This might be a little bit detailed. This was a question posed by one of our Minka Advisory Board members.
Yeah, actually, I think I get it because there's a concept that was originally developed at the University of Washington. You might have worked with it, called patient activation. And the idea was attempting to work our way out of this concept of patients being passive recipients of healthcare services and activating them as human beings, as really as partners in health and well-being. That work foundationally is influencing what a growing number of insurance providers are recognizing, that when people get activated and engaged, they're actually much better consumers of healthcare than when
Mhm.
they just do what the doctor tells them and don't ask questions. So, not just insurance companies, but also primary care groups and home care groups are trying to activate people in outside of the clinical box and saying, you know what? Of course we're here if you break your leg. Of course we can put a cast on that leg. You bet. But we're interested about you more than just your broken leg. We're interested in the whole person.
Mhm.
So, a company, I'll give you an example, a company called LifeSpark in Minneapolis is very active in attempting to build this new kind of relationship with people that isn't built around sickness and loss, it's built around health and well-being, and it attempts to engage people at a time when interventions can actually be even more effective, not in a non-crisis situations.
Mhm.
That's kind of the research framework, the the imperative that providers and insurers are feeling, and I think also a promise for a different approach to healthcare, based on activated people who are activated to be partners in health and wellness.
Mhm. And I'm seeing how are we integrating different sectors? Like how are we integrating the social service sector with the primary care sector? And how are we looking at social determinants of health and public health when we think about primary care? And I think there's space for us to grow from on a national level in that area, for sure.
You know, what you're saying, really reminds me that when professionals talk about um, different types of care or service and support, um, we think of them as discrete bundles. There's the hospital, there's home care, there's social services, there's public health. They're kind of each their own thing.
Mhm.
That's how the professionals think, but the people experiencing it, they don't think. What they see are kind of nodes of expertise separated by terrifying gaps.
Mhm.
And our system has invested in those nodes of expertise, and some of it's pretty amazing. And we've done nothing to mind the gap.
Mhm.
We've done nothing to bring those nodes closer together, to make it easier to move from one node to the other, or combine them so there's no gap.
Mhm.
We
Mhm.
haven't done that work, and you're talking about the future, and I do think that our future is we're going to spend a lot of time minding the gap in between those nodes of expertise.
The spaces in between. Yeah, that's kind of the theme for today. I think we've touched on that with housing as well. So
Hmm. Hmm.
yeah, there's space to grow. That's kind of a message of promise, right?
I
It gives
I
us a
couldn't
space to
agree
grow.
more.
Yeah.
Very optimistic.